All right, today we're jumping into a really fascinating and surprisingly versatile drug called pentoxifylline. Now, it's been on the scene for decades, but what makes it so cool is how it actually works. But first, let me kick things off with a question for you. Just imagine for a second that your red blood cells, those tiny little discs carrying oxygen to literally every part of your body, what if they suddenly became too stiff and rigid? What do you think would happen? Well, you'd end up with a massive traffic jam, but on a totally microscopic scale. These inflexible cells just wouldn't be able to squeeze through the narrowest roads in your body, the capillaries, and that causes a huge system-wide slowdown in getting oxygen where it needs to go. This is the exact problem pentoxifylline was built to solve. So the main FDA-approved reason to use this drug is for a condition called intermittent claudication. Basically, this is when poor blood flow in the legs, usually because the arteries have hardened, causes some serious pain and cramping whenever you try to walk. It is a direct result of that micro-traffic jam we were just talking about. The leg muscles are screaming for oxygen, and they just aren't getting it. So how do we clear that jam? This is where pentafilin comes in. Now, it's really easy to think, oh, it's just another blood thinner, but its approach is so much more specialized. It's in a class all by itself. It's called a hemorheologic agent. I know, that's a mouthful, but the idea behind it is actually pretty simple. Instead of just opening up blood vessels or stopping clots like a lot of other drugs, pentoxifylline, which you might know by the brand name Trental, it gets right to the source and changes the quality of the blood to help it flow better. So how in the world does it actually do that? Well, this is the cool part. It attacks the problem from a bunch of different angles. It's not a one-trick pony. It has this amazing four-part strategy to get that traffic moving again. And what's really amazing here is how all four of these actions just work together so well. First, it makes those rigid red blood cells more bendy and flexible so they can literally fold and squeeze through those tiny capillaries. Second, it makes the blood itself less sticky or viscous by dialing down the levels of a clotting protein called fibrinogen. Third, it has a gentle effect on platelets, telling them to chill out and not clump together to form tiny clots. And finally, and this is a big one for its other uses, it's a powerful anti-inflammatory. And it's that totally unique, multi-layered approach, especially its ability to fight inflammation, that got researchers thinking, hey, where else could this be useful? And that's led to a whole world of off-label uses that go way beyond just leg pain. I mean, just look at this list. It's wild. They're using it to help heal really stubborn skin ulcers and diabetic foot sores. It can treat tissue that's been hardened by radiation therapy. It's even showing real promise for severe alcoholic hepatitis because it's so good at tamping down inflammation. From vascular dementia to certain kidney diseases, its core ability to improve blood flow at the micro level makes it unbelievably versatile. And this quote it absolutely nails it. The drug's real power isn't in any single effect, but in its fundamental talent for reconditioning the blood, turning it back into the super efficient oxygen delivery system it's supposed to be. Okay, so it's a fantastic tool, but like with any medication, you've absolutely got to know the rules of the road to use it safely and effectively. The standard dose you'll see is a 400 milligram extended release tablet, and it's typically taken 3 times a day. And here's a really important tip. You've got to take it with meals. This really helps cut down on stomach upset, which can be a common side effect. Now, this is something you have to know going in. This is not a quick fix. You will not feel a difference overnight. You have to be patient. It can take 2 to 4 weeks, sometimes even a couple of months before you start to notice the effects as your blood flow gradually gets better. And, of course, let's talk about side effects. The most common ones are things like nausea, indigestion, and dizziness, which, again, is why taking it with food is so key. But you also need to be on the lookout for the less common but much more serious issues like chest pain, an irregular heartbeat, or any sign of increased bleeding. Those would mean you need to get medical help right away. This also means you have to be super careful about drug interactions. For example, if you take it with other anticoagulants like warfarin, your risk of bleeding can go way up. It can also boost the effect of blood pressure meds, maybe dropping your pressure too low. This is why it is absolutely critical that your doctor knows every single thing you're taking. So if you take one thing away from all this, let it be this. Pentoxifylline isn't just treating a symptom. It's a really unique tool that works at a fundamental level, literally conditioning your blood so it can navigate your body's highway system way more efficiently.
It's a perfect example of an older drug that we're discovering has all these surprising new talents. And it kind of leaves you with a really fascinating thought, right? How many other established medicines, just sitting on pharmacy shelves today, might hold the keys to solving problems they were never even designed for? Thanks so much for watching.